Hello, I'm Mario Toneguzzi, and this is Business Spotlight. Joining me today is Jeanette Queen, nurse practitioner and founder of EvolveWell, Integrative Medical Centre in Calgary. Thanks, Jeanette, for joining us today.
Thank you for having me.
All right, let's talk a little bit about what you do there at EvolveWell, and we'll start from there.
Okay, we do what is called integrative or functional medicine here, and we help people regain their health in any way that we can and try to help people be healthier and live more vital lives.
And how do you do that?
We look at nutrition, we look at exercise, we look at hormone levels, we look at many different things and many different aspects of health, and then we try to make improvements where we can. We work with our patients. We not only, write prescriptions. We try to do work on every aspect of their health and help them and guide them in different areas to help them be the healthiest and most vital that they can.
All right. So what is the Emsella, if I'm pronouncing that right?
So the Emsella, it's interesting, is a machine. First of all, let me just back up. So my background was in women's health, and I was shocked to find how many women struggle with problems with incontinence, urine leakage. And I learned that from my patients and from my manager, as she said, you ask people about incontinence, they don't think about leaking urine when they're running or jumping or leading a very active lifestyle. And it's something that's not very much talked about. So I realized how much I was probably not asking that question correctly. And then when I did, how many people are affected and how few treatments there are. Really, there's pelvic physio and there's surgery. And a lot of those treatments are not amenable to many people, nor desirable. So I started looking at what was available, and very little other than the Emsella. So the Emsella is a treatment. It's actually a platform that you sit on, completely non-invasive. And there's actually an MRI magnet in the seat that actually pulsates as the patient sits there in certain patterns that stimulate the pelvic floor muscle. And it actually, in 6 treatments, increases the pelvic floor muscle volume by 25 to 35%, which in anti-aging medicine anyway, anything you do to build muscle, you're going to improve health. So it also is 85 to 95% effective, and people are happy with the treatments. So it actually stimulates the pelvic floor muscles to grow and supports the pelvic floor, thus helping with urinary incontinence. It is indicated for both stress incontinence, which is incontinence when you cough or sneeze, or urge incontinence, where you feel like you have to go quickly, or mixed, which is a combination of the 3. And again, completely non-invasive, short treatments. You come 3 times, starting minimally. The minimal is really 6 treatments, but it's within six treatments twice a week for 3 weeks. So it's quick. It's not months and months and months of treatment. And each treatment is equal to over 11,000 Kegels, which you could not do that many Kegels on your own, and you couldn't get the strength of the Kegel exercise to do it on your own. So it really exercises that pelvic floor for you, and it's indicated for both men and women.
Oh, that was the next question I had, whether who benefits from this. So
our main clients that we focused on were women, because a lot of the patients that I see are women. So women, if women have a weak pelvic floor anyway, some just naturally kind of have that. Runners, a lot of women who have focused on cardio neglect the pelvic floor. The pelvic floor holds the whole body up. It's kind of the base of the whole torso. So when we all benefit from exercising the pelvic floor, but people who are overweight put more pressure on that. Women after childbirth, as I said, runners and people who do a lot of cardio who kind of neglect the pelvic floor. Childbirth, and just as we age, men with prostate issues, and especially after prostate surgery. often have problems that the strengthening the pelvic floor can help tremendously.
Oh, very interesting. So what treatments are complementary to the Emsella?
So complementary treatments, again, if someone is overweight, losing weight will take some of the pressure off the pelvic floor anyway. And many women after menopause are estrogen deficient. So the vagina also becomes estrogen deficient. It becomes dry and more lax. So oftentimes hormonal treatments, either locally or systemically, help. Men, testosterone oftentimes will help because testosterone, even with women, helps build muscle. When we lack testosterone, we lose muscle. So estrogen, testosterone, like I said, either locally or systemically, weight loss, all of those things help as well.
All right, super. Thanks, Jeanette, for joining us today.
Thank you.
All right, that was Jeanette Queen, nurse practitioner and founder of EvolveWell, Integrative Medical Centre based in Calgary. I'm Mario Toneguzzi. This has been Business Spotlight. Thanks for joining us today.